Welcome to the Healthy Kids Minute.
So the most important thing for moms to know when they're setting out to breastfeed is to be confident that their bodies were made to be able to do this.
Dr. Lori Feldman-Winter is a professor of pediatrics with the Children's Regional Hospital at Cooper. She encourages expecting mothers to prepare for breastfeeding before entering the delivery room so that they are ready to start immediately following the birth.
The reason for breastfeeding in the first couple of days of life is first to establish the behavior, the suckling patterns, to make the suckling less painful and more effective. Secondly is to establish mom's milk supply. And third is to get very small amounts of what's called colostrum. And that actually is important because that's what establishes the baby's immune system. You can only get colostrum in the early parts of feeding, the first couple of days of breastfeeding from a mother who's recently delivered.
Dr. Feldman says some new moms abandon their effort to nurse because of a misguided belief that the baby isn't getting enough to eat off the breast.
So where a bottle-fed baby may be getting as much as a half an ounce to an ounce per feed, a breastfeeding baby actually only gets a teaspoon per feed, but all you need is that 1 teaspoon to establish the normal immune system for that baby.
According to Dr. Feldman, the amount of breast milk the baby receives will ramp up over the course of time, as will the health benefits that come with it.
The short-term benefits for the baby in particular relate to all the different ways that breastfeeding protects against diseases, particularly upper and lower respiratory tract infections. Long-term, the benefits that we see relate more to the immune benefits that actually outlast the periods of breastfeeding. So a reduction of asthma and eczemas. We also see a reduction in things such as inflammatory bowel disease and celiac disease, and even cancer that we now realize has an immunological basis.
And for those women who choose to breastfeed, continuing help is available even after they leave the hospital.
There are a lot more opportunities than there used to be in terms of reaching out to peer support groups, community support groups, baby cafes, and even professionals who support breastfeeding.
This has been the Healthy Kids Minute.